Okay, so today we're going to talk a little bit about joint anatomy. And the idea for this video really comes from helping the clients or the athletes that I work with just better understand their body. And when I take a look at them and assess their range of motion, I listen to them and hear about the different muscle tightness or tension they're dealing with, the joint stiffness, the injuries, and so forth. So many times it comes back to missing joint range of motion that their activity or their sport requires them to have. And it's really important to understand that, depending on what movements you like to do, that there are certain determinants that allow that movement to take place. So if we take a squat, for example, you need to have appropriate shoulder mobility, hip mobility, knee, ankle, and spine mobility, right? Even wrist mobility is going to affect your ability to perform a squat effectively and efficiently. So let's kind of break down joint anatomy so that you better can connect those dots between the exercises that I or your practitioner provides you with kind of the why behind it. So if you take a joint, and let's just take the hip or the shoulder joint, for example, because they're a lot easier to explain. So joints, as we know, are when two bones articulate with one another. So if we take this ball and socket joint, if you strip away all of the musculature, what you are left with is all the deeper layers of connective tissue that surround or envelop that joint. So around this ball and socket joint would be encased a joint capsule. And the joint capsule is a dense, fibrous sort of piece of connective tissue or layers of connective tissue that encapsulate that joint. And what's really interesting about the joint capsule is that it's extremely dynamic, meaning that it has the ability to stiffen, it has the ability to become more elastic, it can become thicker in certain areas. So take your shoulder, for example, it could become thicker in the posterior aspect of your shoulder than maybe it is in the anterior aspect of your shoulder. And all of those adaptations and changes, those accommodations, then will affect your range of motion, how deeply you can get into a squat, how much you can press overhead. And the reason behind that is because when a joint capsule starts to become unhealthy, it will actually start to shrink wrap that joint. And again, sometimes just in certain places, just in maybe the posterior capsule. So for a ball and socket joint that needs the ability to rotate or glide and slide or even spin, and if that joint capsule shrinks the joint, you are going to lose joint space, thereby not allowing that ball to rotate quite as well as maybe what it did a few years ago, 5 years ago, and so forth. So what we then try to do is we try to give people exercises that challenge their range of motion, and then we input forces into that connective tissue, into that joint capsule. So it teaches that joint capsule how to remodel, reorganize, rebuild itself in the ways that we want it to, so that they can then get better into positions. And not just that, but they actually build strength and control in their end ranges and have access to more muscular tissue, and thereby typically are going to increase their performance. The other interesting thing about joint capsules is that they are embedded with mechanoreceptors. And these are specialized nerve receptors, type 1, 2, 3s, and 4s. They all have a little bit of a different role, and they all sort of become activated at different points during your range of motion. Type 1s, for example, are always active. They're always providing your joint your brain information about your joint. And what's interesting is that type 3 mechanoreceptors really only become activated when that joint capsule is pulled taut. And all of your joint capsules are rotational tissue, so it takes rotation in order for those mechanoreceptors to become activated and send information up to your central nervous system about what's going on at that joint. So it's really important for us to continually activate and train those mechanoreceptors so that they are giving your brain a really good picture of what's going on with that joint. Thereby, it typically is going to reduce pain, stiffness, and some of that neurological tightness that a lot of people will feel in their lower back, their hamstrings, and so forth. So hopefully that helps you understand a little bit more about joint anatomy. If you have any comments or questions, leave them in the comments below, and thank you for watching.